So the number one killer for women, especially, is not cancer. It's actually cardiovascular disease, which is quite shocking to a lot of people because I think we've gotten so good at our detection of cancer, making sure we get those mammograms, those exams early on, but no one really talks to you about screening for cardiovascular disease.
All right. Hello, everyone. John Heringer here, Chief Motivator over at Method 3 Fitness, bringing you another episode of our Stronger for Today show. And I'm excited to meet with Dr. Bhavana Prakash, who, interestingly, is the spouse of one of our awesome partners here at Method 3. So we're very excited to have you as a part of the community. And I'm excited to dive in with you because of all the amazing things you're doing just in cardiology. And I know that's your passion. I'm excited to dive in specifically as it relates to women, some of the gender-based disparities therein around cardiology. So maybe start with just a brief background of kind of who you are and a little bit of your education, but also kind of where you like to do a lot of your research and what you're kind of doing right now, because I think that'll give the audience a little bit of an understanding of why you're such an expert and what we're going to chat more about today.
Thank you. That's a great segue into who is this person. So I'm Bhavana Prakash, and I am a physician assistant by training. I finished my training at Stanford Medicine and then went on to get my doctorate, and I currently work in cardiology in a very subspecialized crew. I work for advanced heart failure transplant team, and I also run the adult congenital cardiology program at Stanford. I am very passionate about women's health, being a woman myself, and the disparities I see at work and in the community. I'm also very passionate about making sure that individuals are self-motivated in taking care of themselves, because that, I think, goes a long way in making sure that you're your advocate for yourself and your health care. While I'm not doing my medical stuff and, embarking on journeys and with data and research and patient care, I also serve on the Physician Assistant Board of California. I was recently appointed by Governor Newsom, so I'm excited about that. And in my free time, I find time to clear my head, essentially, and put what I preach into practice by coming to Method 3 and letting it all loose.
Excellent. Excellent. I love it. Well, thank you so much for that. So let's chat a little bit about some of these gender-based disparities. I think the first thing that, I want to connect with is that we were chatting about how I think many women think that cancer is, one of the biggest, killers, so to speak, of women across the country in terms of, okay, this is the number of deaths related to cancer, but in fact, the number one is cardiovascular disease. Is that correct?
That is actually correct. So the number one killer for women, especially, is not cancer. It's actually cardiovascular disease, which is quite shocking to a lot of people because I think we've gotten so good at our detection of cancer, making sure we get those mammograms, those exams early on, but no one really talks to you about screening for cardiovascular disease. How often do you go to your physician, or when you go to your physician, that they say, what is your blood pressure? Have you checked your cholesterol? What are you doing for your lifestyle? Are you sedentary? Are you moving? What are you eating? Things that people don't think about. And unfortunately, that's where it leads to heart disease being such a profound impact on us. And I don't want to just say it's just women, it's men too, but it's definitely women that we see that disparity a little bit more.
And something that's very preventable, correct? Right, with a lot of different interventions that are there, not just on the medicinal route or prescription route, but also just lifestyle, right? So maybe you can dive into a few of these disparities, though. I know we talked about sometimes how the onset of symptoms, things that happen in the field, the data. I'd love for the audience to understand that the reason you're so passionate about this is that a lot of this has related to men, right? And so as you're diving into this and trying to create a little bit more kind of understanding, awareness, and equality for women, it goes deeper than that, and there's a certain level of like education and understanding that has to take place first for a lot of people.
That is correct. As a clinician, when you look back at data, most of our practice is based on database and what do we have for research, our medications that we choose. It's all about the data that's been studied, what has worked, what has not. If you look at it all, it's all based on male population. There's very few studies out there that address female cohort or studies or drugs that have been trialed on women. So there's the first disparity because we were slowly realizing that we don't have enough data about how women react to cardiovascular disease. What does that high blood pressure mean for women? What does the cholesterol labs show for women? How do we address it? Is diet alone enough? Things like
Mm,
that, which makes it a little hard for us. And then the second part is the symptoms. The cardiovascular symptoms that show up for men are very to the point. You have the angina, you have the chest pain, the shortness of breath, you have the pain down your arm, the classic symptoms everyone hears about. But for women, it may not present the exact same way. It may show up as back pain, it may show up as belly pain or abdominal pain. And you're like, something's not right, but I'm not sure what it is.
yeah.
And as clinicians, we have also like, if a woman shows up in a clinic, often when the complaint is back pain, we forget. We
Yeah.
as clinicians end up focusing on, oh, you must have lifted something. You must have, done something. You must have turned. We forget to get an EKG. We forget to actually dive into what is going on exactly. And then more in the more acute setting, I think we talked about this earlier. When a woman in an emergency setting, CPR is highly advertised. Everyone gets their basic training. They know how to do the CPR. They know how to call 911, all of that stuff. But when a woman is down, very few of them get the necessary CPR. How many of you, how many times have women like been down on the field, and often there's hesitancy because you don't want to be that bystander who is jumping in there trying to do CPR. It's a woman, you're not sure. There's the morality of things, the community setting. So it's like a little bit awkward, if I may use that
Right.
word.
Yeah.
So, that's why women lose out. So when they do show up in the ER, it's already too late. We have not done what
Mm,
we were trained to do, and we have failed this particular woman that has had this
yeah.
or issue.
That's so interesting. And Bhavana, are there certain things then? Because I think one thing you noted there on the symptoms that women are experiencing, right? And then, not necessarily, it's not with malice that, anyone that's doing the intake for that woman is saying, "Oh, did you lift anything?" Right? They're not trying to steer them some way. They're just not necessarily thinking cardiac event. Are there any specific questions that women can ask to kind of be their own advocate just in case, right? Like, are there questions they can ask when they get admitted or when they're coming in to see the doctor for an appointment because they're experiencing these things, which, I mean, they don't know necessarily what it's from, but are there any specific questions that they may want to ask or things they may want to bring up to the person doing that intake, no matter what their position, to help them get the care that they need?
Yes, that's where personal history helps. Like, tell them if you've had these symptoms before. Tell them if you think that this is unrelated to any activities you may have done. A physician sees you in a little span of time. Remember, medical visits have gotten shorter and shorter, and it's become very focused nowadays. So you can be your best advocate by telling them your genetic risks, especially if you have a family history of heart disease. Make sure you mention that. Make sure you check and see what your blood pressure is, and then ask the doctor if, what is my blood pressure? Is this related to the pain, or is this something I should be monitoring at home? You've never had labs before. You don't know what your labs are. Ask the physician for routine labs. That won't take too long. Just get that done. And then ask if you think that diagnosis doesn't fit what you are seeing or feeling. You have the right to ask. In
Mm,
medicine, we are taught it's shared decision making. There was a time when medicine was all about, you listen to the doctor, you accept the diagnosis, you walk away. But more and more, medical training has focused on what we call shared decision making, where we talk to the doctor about what's going on. We try to understand what the doctor's thoughts are, and then we come up with a plan on how to address issues.
excellent. Okay. I appreciate that. So let's kind of segue from, so these are some of the symptoms that women can be experiencing. We've talked about some of those disparities as well. Hopefully, as things continue to improve, even with the use of AEDs or things like that, we can start to move away from some of the awkwardness, as we talked about, or cultural norm, unfortunately, with how women are actually assessed and addressed on the field as it relates to CPR. But let's now rewind. Let's say, okay, now before we're even symptomatic, there's certain things we can do from a preventative standpoint, and then even certain things we can do, not just preventative, but also if we did get diagnosed with some type of like, oh, it looks like we have, some arterial plaque, or we have, really high lipids, we can look into different prescriptive protocols as well. So maybe we'll chat a little bit about both. Disclaimer here, personally am not a doctor. I have no, one way or the other, whether they're going to do preventative or prescription. I think there's sometimes cause and reason for both, obviously. I'm very heavily weighted towards preventative, given what I do in the fitness and health field. But as such, consult with your physician on anything. There's pros and cons to any which way you take certain things. There can be extremes on both sides. Okay, end of disclaimer. So on the preventative side, Bhavana, what are certain things you discuss or that you found that are particularly effective for people? And we can obviously these things I'm sure can be utilized for both genders, but since we're talking mainly about women, things you found that can be very helpful for them on the preventative side.
I think a women's risk for heart disease changes with age. Early on in a 20s and 30s, that's the time, that's your golden period. That's when you should be working on improving your health care per se by moving more and being able to do activities that are helpful, such as strength training and things like that I go a long way. Because in your 20s and 30s, your metabolism is so active. That's your chance. You can eat whatever you want and then still work out. So use that time to build your habits. If you are drinking, if you drink socially, etc., think twice about, do you really want to binge drink? A lot of people I talk to, they talk about, I don't drink anything during the week, but on the weekends, I hit that 2 bottles of wine. Maybe you shouldn't do that.
Right.
Red wine is great, but and I'm not saying completely give up drinking. Know your risk factors, and then be moderate. The way women metabolize alcohol is very different from a male. So make sure you understand that when you drink your alcohol, and then give up unhealthy behaviors such as smoking, vaping, all of the things, all of them are not great opportunities they're not great, substances that you should be putting in your body. So think twice about those. We've all done it in our college years. We've all experimented on things, and marijuana is legal in California. So I'll put it out there, but think twice and be more reasonable in what you want to do for your body. And then once we hit the fees, that's when it becomes so much harder with hormonal changes, the estrogen going away. You see that hormonal belly, you see that fat, everything's jiggles, literally. So that's the time when you need to build up on your lifestyle that you have already implemented. Make sure you're working out. If you're not able to work out, walk. Medicine dictates that you should walk at least 30 minutes a day. I mean, what is your excuse not to be able to move 30 minutes a day? Every single person, we live in California, we have smart watches, tools. Track yourself. Track what you do. You utilize those watches for what it's made. Track your symptoms, see how you're doing. See if you can get to that 3,000 steps or 5,000 steps, things that'll help you in the long run. And then diet plays a big part of things. Of course, that doesn't mean that you only eat celery for the rest of the week kind of thing. You can indulge. It's not unreasonable to indulge. Your body craves it. If you are starving yourself, your liver will tell you, your body signals that you will need calories, etc. So eat when you need to, but just make sure that you balance everything out equally. There should be equal movement as well as calories, and then fluids, the waters, the drinks that you need to hydrate. These are all very helpful. So I think for me, that's the biggest point that I would make for patients when I tell them lifestyle changes.
I appreciate it. Yeah. And there so many things, right, that you just rattled off. And all of those are in our control, right? I think a lot of people that I've connected, over the last, 15 years with Method 3, 20 years in the health and fitness industry, many people as they're trying to make changes can sometimes tend to be all or nothing and think that there can be no middle ground. And I think, a lot of what I heard you just say is moderation, and a lot of what I heard you say is some would say common sense with some of these things, but the unfortunate part is that common sense isn't always common practice, and that it can be harder to implement and overcome these different like habits and behaviors that are so ingrained. So what I really love that I wanted to pull out was you spoke about creating those healthy habits and lifestyle and behaviors and patterns in your 20s and early 30s, where most of us aren't even thinking about it, to be honest, right? Because we're enjoying that glorious decade of fast metabolism and everything else, right? Skin elasticity, all these beautiful things we got, tons of hormones, everything we need. And then as we age, we're like, whoa, okay, things are shifting and changing around here, right? To your point, I think even more pronounced in women than in men, and can be a challenge. And it's like, wow, we need to really be on top of these habits and patterns and behaviors, and where can we just be more observant, where can we be a little bit more mindful, make some small changes, and that it doesn't have to be not just all or nothing, but it doesn't have to be extreme. And I love how you said, pretty much almost no one can say we don't, you don't have 30 minutes to just go out and walk. And even that we could say, if you don't have 30 minutes in a row, you probably have 3 different intervals of 10 minutes apiece you can get out and walk. And so a lot of times just putting that together, I always, will say, hey, any piece of a workout is, even if it's just 20 minutes where I'm in and I'm out, or I did something, it's like, so I literally keep my ruck, my heavy weight pack in my truck so that no matter where I am, I don't have an excuse not to throw that thing on my back and go walk for 10 minutes. Right. And I know this is what I do, and maybe I have it on my brain a little bit more than others, but I think sometimes it's how can we put certain things in a position for ourselves to be more successful, right? If I didn't have that in my truck, it wouldn't look at me every time I open up my car door, right?
Right.
So it's a constant reminder of where can I squeeze something that's going to be beneficial for me, and then the other benefits that come with it. Not only am I probably impacting things that will help with my heart health, but I'm also going to probably get some vitamin D. I'm going to feel a lot better. My mood's going to be improved. Like there's so many things that then say, cool, that's also going to be a stepping stone to making me feel like I want to do that habit again. Right. And over time we get to, realize the benefits of hopefully improved lipids and, things like that, which will decrease our risk of these different cardiac events. So love it. I love all of it. So let's dive in a little bit on the, and again, on the nutrition side, I'll just briefly say again, I'm not going to dive into the specifics for everyone. You touched on a little bit of the basics and just the hydration and even the sleep. And nutritionally speaking, I think a lot of the audience out there will understand like, hey, it's not a specific diet. There's a bajillion diets out there, and they all work for different people. I think what the most important thing is we know we should probably eat some fruits and vegetables. We should probably get some types of fiber. We should get some lean protein in there, and we should have moderate portion sizes. That's probably the biggest thing we talk about a lot. And something that's sustainable. That's what I always tell people. It's like there's not any particular diets out there, because people always come to us Method 3 with questions about particular diets. And they're not inherently bad. I will say some can serve others. I think as I spoke to you, I experimented with the ketogenic diet and found out that per my own genetic predisposition to cholesterol and what I do with it, it was not a good diet for me whatsoever, even if I was able to sustain it for a certain period of time. Is that as long as some of these different eating patterns people are engaging in have some semblance of healthy foods and is sustainable for them over the long haul? That's always my question. It's like, hey, I know it might be working. Is it something you can do for the rest of your life? And if the answer is no, let's find something different. But aside from all the preventable things, I want to dive into when people actually get their blood work, because I think a lot of people will say, like you said, hey, ask your doctor for just a basic like lab and panel. And I think sometimes people don't necessarily know what that means when they're looking at that, right? So without diving too deep, can you go over just some of the things that people should know about, like a basic lab panel as it relates to cholesterol? And we spoke a little bit about, I know we can go down a rabbit hole quite easily, but we spoke a little bit about LP little a, ApoB. I'm sure those are the buzzwords people are hearing. If they're listening to anything by Dr. Attia, they've probably heard that. So can you chat about some of that so that some of our people listening can hopefully walk into that, ask for some certain lab or a lipid panel, and then actually understand some of that with their primary care doc?
So before I delve into cholesterol, I would say, you know, there are other labs out there like iron, which is very important. Are you anemic? Why are
Mm,
you tired all the time? So make sure you understand where that's coming from. So
yeah.
there is no age limit when you should be asking for labs. My teenager, or soon to be adult, it's labs annually. And because he lives in college and because he drinks and I know he does other stuff, I want to make sure that his cholesterol is in range and he is taking care of himself. So there is no age limit on when you should be asking. No guidelines tell you that you should only ask for a certain lab at a certain period of time. As
Excellent.
far as labs that we should be asking for, a blood count is always a good one for men and women because you need to understand your risk for anemia. You need to understand if you're iron deficient because these can tie into your feeling tired all the time. These can tie into heart disease down the line. So you need to be able to articulate, get my CBC done. Let's make sure that I'm not deficient. Vitamin D, another pro-inflammatory marker, is something that we should be checking and repleting. It's just a vitamin over the counter, but vitamin D deficiency has noted in individuals with high inflammatory status, etc. And technically, you should be getting your vitamin D from the sun. But how
Yeah.
often do we all just sit out there and just get the sun in your body? And then for South Asians like myself, we are genetically built in such a way to protect us from skin cancer. Our skin cancer risk is low because of our genetics. And because of that same reason, we don't absorb vitamin D as a Caucasian or any other race. So we are
Mm,
inherently low in vitamin D, which is also very interesting to me.
yeah.
Then let's
It
talk
is.
about your chemistry panel, your basic metabolic panel. Understand where your kidney numbers are. And that doesn't have to be done every time, once in a while, as long as you know where you are in your baseline, your kidneys are fine, everything looks good. That's a good marker to have. Then the next thing is thyroid. We don't check our thyroid levels enough. Thyroid is essential for metabolism. It can cause so many issues. If you're low on thyroid, you could have hair loss, you sleep poorly, you should be tired all the time, cold, warm, all of these things. So thyroid is something you should check at least once a year and should be monitored and maintained because that ties into uncontrolled cholesterol, things like that. So make sure you check your thyroid levels. Then let's talk about the lipids. Cholesterol levels always get a baseline for sure. Again, no age limit on when you should check it. Get the cholesterol done, understand what that panel means. LDL is usually considered the sticky bad cholesterol that kind of like coats your blood vessels and causes, plaque buildup, etc. And HDL is what we call the garbage people that go in and collect all the bad cholesterol, clean up, get it to the liver and clean things up. So understand those two. Sometimes your triglycerides may be high because you're having too much carbohydrates and you're not metabolizing the carbohydrate level. So triglycerides are important. But then that also ties into things like lipoprotein A, B, all these little particles, which if you want to understand your cholesterol profile a little better, you can ask your physician to run those tests. Most of the time, when it comes to that, and you are noted to be a cholesterol or a statin, which is the drug we use for cholesterol management, resistant individual, then advanced labs, just like you said, John, are necessary to understand what's your best cholesterol profile and tailor the medication therapy towards what's the drug that you're taking.
Excellent.
Diabetes, don't forget that one. Make sure you
Yeah.
get an A1C to understand your risk of diabetes. There has been more and more individuals diagnosed with type 1 diabetes later in life. Previously, we thought type 1 diabetes was only what children have, but we are seeing that more and more with the young adults. So get your A1C, hemoglobin A1C done, understand your risk. So those are the basic labs that I think everyone should have at some point in their life.
That's great. I appreciate that. And I think so much of what you spoke to, again, comes back to lifestyle factors and comes back to people being able to make substantial changes. And I think, for anyone, sometimes it can be scary, daunting, unknown a little bit when you're going to go in and get these labs, especially if it's been a while since you have. I think it's important to look at them as you just indicated, which is information. It's information, and there's going to be some information that may not be rainbows and unicorns, and places you need to make some shifts and changes. But those can become goals, and I think the neat part is, um, you know, far too often people that we see in health and fitness, I think, will say, okay, I need to come in and lose weight. And that may be the case. I mean, yes, obesity can be obviously a big risk factor from a health perspective, but I think sometimes it's what is the shifts to lose the weight and the habits and patterns and behaviors as it relates to exercise and lifestyle and sleep and water and nutrition. How is that actually going to impact these labs over here?
Yep.
And
Yep.
so sometimes I think it's just flipping the scope or the perspective with how we're looking at some of these goals. And that's kind of what at least myself and sometimes the team and coaches and that we work with at Method 3, will help partners understand is we don't have to look at the scale per se at all. I mean, that can be a byproduct of focusing on some of these habits and patterns and things we want to change in our lifestyle, but ultimately using these labs as a goal and say, how can we improve these numbers, which inherently by doing so will, wow, I dropped 10 pounds along the way.
That's going to help.
So it kind of
Yep.
just, yeah. And I think sometimes it can help shift perspectives because sometimes people
Yes.
can get very hung up on this little thing that we stand on sometimes. But that's so great. And what I want people to really kind of glean from this is, yes, we're talking about, cardiac health, but there's so many other factors and things you just spoke about related to diabetes and vitamin D and CBC and A1C and all these different things, that iron levels, right? Thyroid, all these things that
Yep.
are also important, that are part of these labs, that aren't only specifically about cholesterol.
Yes. Correct.
And is there any numbers, Bhavana, on, I think I spoke to you a little bit about my personal case and my little journey with cholesterol and fun deep dives. But there are certain individuals that are genetically predisposed to high cholesterol or different factors. What percentage of people, though, just in general, U.S., and if you want to get even more specific to women, if you have that data, great. If not, but what percentage of people are typically able to influence their different lipid panel information that they get from their doctor with simple lifestyle factors without medicinal intervention?
I think at least 60%. Initially when you get diagnosed with cholesterol, there's that moment of panic. It's like, why? What? I have cholesterol? How is that possible? I'm too young to have cholesterol. But then, it's also, again, shared decision making. I'm coming back to that. When you get that diagnosis from your physician, ask for time, work out, see if you can make those lifestyle changes, come up with a plan on seeing how you can address it. There is nothing out there that says that you need to be on a medication right away. Show that you have failed first doing your lifestyle changes. And then if that doesn't work and you have a genetic predisposition, of course, you have the choice of taking the medications that you need. And then one thing I want to put in or talk about here is women don't tolerate statins as well as men do. There's something about the
Mm,
absorption of statins. We seem to have a lot more side effects than men. So it also becomes a little bit harder in taking these statin medications. So one size doesn't fit all is,
yeah,
lifestyle modification is always the first choice for any diagnosis that is related to cholesterol. And at some point in time, you may have to look at, okay, I've tried all this, it doesn't work. What more can I do? Can I try something else? And then have that discussion about trying medications.
I love it. I love it. And I really hope what people are hearing is that this is empowering, you to take action, right? On
Yep.
everything that you can do.
Yep.
And I think sometimes I just want to reiterate, it can feel overwhelming with so many things we rattled off that you can influence with sleep and water and nutrition and this and that. And that ultimately you just need to take the first step, right? And do it on your own, do it with a friend or a buddy or a relative or someone else going through the same thing, or go to a place like a Method 3, get a coach, whatever it is. One step is better than nothing. I, for one, hope you continue to kind of stay on the forefront. I love hearing more about that information, that women obviously have different absorption rates and different side effects in men as it relates to statins. And obviously there's probably not enough data on that as well. And that there is no one size fits all, but at the end of the day, changes are the number one and the easiest thing to attack first, right?
That is correct. Yeah.
That's awesome. Excellent. Well, this has been great. I really appreciate all your time, Dr. Bhavana. I love having you and the whole family as partners of Method 3. You guys are just salt of the earth, fantastic people that we love to have. We feel very blessed to have so many people just like you at Method 3. This has been a really informative chat. Appreciate your time and look forward to seeing you around.
Thank you. Thank you. This has been really helpful, and thank you for inviting me to this panel. And as a woman myself and addressing, after 40 age-related changes, Method 3 has been very helpful. And I love the Method 3 family. It just helps all of us. And we're very appreciative for having you in our lives.
Excellent. Well, it's likewise. Yes. Well, have a great day. And thank you for joining me again on the Stronger for Today show. Have a good one.